To tonight's big interview, Governor Greg Abbott joins us live here on KPRC Channel 2 News with an update on the response to the coronavirus pandemic.
Governor, good evening, and thank you so much for joining us. Let's start off by talking about, I know you said there are thousands of hospital beds available right now. How many people are currently in hospitals in Texas being treated for COVID?
There's a little bit over 800 people, Texans in hospital beds being treated right now. If you would, the number of people per hospital bed available is a very small percentage. So what we wanted to lay out is to make sure that the public understands we have more than 19,000 beds that are available right now across the entire state of Texas for anybody who may need to go to the hospital because of COVID-19. We are showing a hospital capacity that should exceed the highest level of demand. That also includes more than 2,000 ICU units and more than 9,000 ventilators.
Governor, with so many people being laid off, and that's only expected to get worse in the coming weeks, will the state step in to help provide the business community any relief?
Well, there's a lot of relief coming in for both those who are laid off as well as for the business community. First, for those laid off who would be categorized as unemployed that lost their job and would be eligible to receive unemployment benefits. Know this, there's a long line of people trying to get their benefits because there's such a massive increase in the demands for those benefits. What I did was I waived a law that required you to get your benefits when you sign up. Instead, I'm allowing you to get your benefits when you first sustain your claim, meaning when you lost your job. So don't worry if you haven't been able to get in to get your claim, but also know this. Congress passed legislation that provided funding to ensure that your unemployment benefits will be extended. Then on top of that, money is flowing through the banks today. There's stories about all these major banks in the United States where they are working to provide that funding to these local businesses. And so local businesses need to get out there and apply for that funding.
All right. Yeah, we know it's a very serious economic crisis as well. We also want to talk about NRG Park. We know you mentioned earlier that could potentially be a location to potentially treat patients.
Sure. The way this works is we identified all these hospital rooms across Texas, but we want to make sure we have these ancillary facilities in the event that all the hospital beds do get filled. We opened up one already, the K. Bailey Hutchinson Convention Center in Dallas, which is available. And we do that. The way it happens is the Army Corps of Engineers scouts out the entire region, makes recommendations about locations. They do that working with the Texas National Guard, and then we work with local officials. NRG Stadium is one location identified in Houston that would be consistent with what we have in Dallas, where they would be capable of providing access for thousands of beds in the event that it's needed. But understand this, Houston has one of the best capabilities of hospital facilities in the entire world.
No doubt we do. Real quick before you go, what do you wish, Governor, that you would have done differently so far?
Listen, we get up every day and work to make sure that we provide the resources that our doctors and nurses need on the front line. Let me tell you what we've done just in the past 6 days. We've provided more than 1.4 million face masks, 190,000 face guards, 2 million gloves, and about 160,000 gowns. Our job is to make sure we provide the PPE, that we provide the hospital beds, that we provide all the resources that are needed for everybody to respond to this. And it's important for everybody right now to make sure we slow the spread of the coronavirus by everybody staying home unless you need to go out to something like to the grocery store.
All right, Governor Greg Abbott, thank you so much for joining us today.